Well, new data from Queensland Health has revealed the disturbing extent of the state's health crisis, including an historic worst for ambulance ramping. On average, 21 ambulances were waiting outside Queensland's overloaded emergency departments at any given hour in the 3 months to June. And for the first half of this year, over 85,000 hours of paramedics' time was wasted just waiting outside of busy hospitals. And meanwhile, the majority of bush facilities in Queensland are operating with fewer doctors or nurses than 18 years ago, with 14 towns without a dedicated doctor in their local hospital. Well, joining me now is Queensland's Shadow Health Minister, Ros Bates. Ros, welcome. The Palaszczuk government's been in power for a fair while up in Queensland. We see Labor governments continually elected around the country on the basis of fixing the health system. It happened in Victoria, it happened in South Australia. There's not much to be shown in terms of results. How do you get to a position where 85,000 hours get wasted by people just waiting around to get their patient into a hospital?
Well, thank you, Caleb, and good evening to your viewers. We have had 9 years of a Palaszczuk Labor government, 3 terms of that government, and now we're up to our 4th health minister, and today we see records being broken for particularly the month of May in ambulance ramping. So for viewers, ambulance ramping only occurs when there is no room at the inn. There are no beds to offload patients to. The ED staff are madly scrambling to try and find a bed or to send you home, and this has been happening for quite some time in Queensland. 45% ambulance ramping, it's the worst in the nation. We know that 16,000 hours were lost on the ramp just in the month of May. That's 517 hours for every paramedic. So that is 517 cars off the road in that number of hours that could have got to you in your hour of need. Ambulance ramping is a plague here in Queensland, and it's something that the Palaszczuk government has no solutions for. The history of ambulance ramping is that under Anna Bligh, when she was Premier here, it was at 30%. Under the LNP government, it was 15%. Under the Palaszczuk government, before COVID, it was 30%, and now it's at record 45%. And our hardworking paramedics didn't sign up to sit on the ramp for hours and hours. And what that means for you and your loved ones here in Queensland is if your father is having a heart attack, your mother is having a stroke, your grandfather's fallen over and broken his hip, or your kid's having an asthma attack, there are ambulances stuck on the ramp who can't get to you in their hour of need, in your hour of need.
Forgive me for being simplistic here, but every government in this country knows that the population is increasing. As I talked about at the top of the show, we're bringing in another 900,000 people into this country, plus all the people who get born here anyway. On that basis, you clearly need more hospital beds. When a government's been in power for 9 years, how hard is it to go, OK, there's going to be more people in Queensland or more people in South Australia or wherever it is, we need more hospital beds. I mean, that's why people end up ramped, because there are no beds in the hospital or there's no room in the emergency department. How hard is it to create more room?
Well, exactly, Caleb, and this government has failed to plan. The AMAQ last year said that we were 1,500 beds short in Queensland. Now the big build that the government talks about, most of those beds aren't going to come online until 2026. I mean, on the Gold Coast, for instance, we've been calling out for another 800-bed hospital in the northern Gold Coast because the population has exploded. And I mean, who would be surprised that people wanted to move to beautiful Queensland? It's not something that happened overnight. And unfortunately, this is a government that has failed to adequately resource our health services, whether it be in beds, whether it be in workforce planning for the future.
Just quickly, Ros, we've got about 30 seconds here. When I was down in Melbourne, there were reports came out from the health service down there that because of issues like ramping and certainly issues within the 000 system, people died because they couldn't get an ambulance to them in time. Are there any reports that similar is happening in Queensland?
Well, Caleb, I'm a registered nurse and a former hospital administrator, and I have been saying that patients will die on the ramp. I have been saying that patients will die waiting for a 000 call to be answered, and that has occurred here in Queensland. And that is absolutely appalling in this day and age, that even in southeast Queensland, an ambulance can't get to you in your time of need. And, you know, we need to get rid of the Palaszczuk Labor government because they have run out of ideas.
Ros Bates, thank you for your time.